Okay. Okay, now? Okay. Yes. We welcome Dr. Chanda Shah to this session of ours, Vasai Virar Homeopathic Association, where we invite esteemed guests to lecture us on their practice and the kind of practice which will enhance our homeopathy. We have students, we have practitioners, we have people from all schools of thought over here. Let me introduce Chanda ma'am today for all of you. Chanda ma'am has been in practice since 24 years, and we are very happy to know that it is a kind of integrated practice. She's learned under Dr. Vijaykar sir, Dr. Shankaran sir's sensation method, predictive, and the Mahesh Gandhi sir's PEM module. And she has formed her own understanding and is practicing at Grant Road since so many years. So we would like to know from her the present condition of fever which is going on. So today we will learn more about management of fever cases. We are seeing lately so many cases of dengue, chikungunya, malaria, and the viral fevers with arthritis going on. So what better time than this to understand about fevers from ma'am. Welcome ma'am, and thank you so much for agreeing to guide us. Thank you so much. Yeah, just a moment. Chanda ma'am, I want Anuprita Pednekar ma'am to just talk for a minute.
Hello. Dovi. So I don't know तुम्ही कोणी डॉक्टर चंदा शाह यांना ऐकलंय की नाही मला माहित नाही, पण मी रिसेंटली पीएम चे बरेचसे लेक्चर्स अटेंड करते इव्होल्युशन मेथडचे. सो त्याच्यामध्ये डॉक्टर चंदा शाह यांचे खूप चांगल्या केसेस आणि त्यांचं अंडरस्टँडिंग बघायला मिळतं. पण सगळ्यात पहिलं म्हणजे ऍज अ डॉक्टर मी काहीतरी एक्सप्लेन करू शकते. म्हणजे एवढी कन्सिस्टंट प्रॅक्टिशनर किंवा एवढं पर्सिव्हरन्स असेल कोणाकडे मे बी मी पहिल्या या डॉक्टर बघितले असतील. मी आय डोंट नो चंदा मॅम, यू कॅन जस्ट रिकरेक्ट मी इफ आय एम नॉट रॉंग. जर का पेशंटचं औषध त्यांना मिळत नसेल, म्हणजे खूप वेळ झाला काही नाही, व्हॉट शी डज, व्हॉट आय हॅव हर्ड फॉर द फर्स्ट टाइम फ्रॉम हर साइड, की त्या पेशंटच्या घरी पण जातात किंवा त्याच्या बरोबर शी विल जस्ट स्पेंड सम टाइम ऑफ हर्स, की कॅज्युअली पेशंटला बघतात अँड इव्हन फ्रॉम दॅट ऑल्सो शी गेट्स द मेडिसिन. बऱ्याच वेळा आपण आपल्या समोर पेशंट काहीतरी बडबड करत असतो, पण ऍक्च्युअली पेशंट काय करतो हा डे टू डे लाईफ मध्ये काय करतो त्यातूनही करतो. सो आय हॅव हर्ड दिस थिंग सो मच, अँड दिस इज द फर्स्ट डॉक्टर की मी असं ऐकलंय की त्या स्वतः पेशंट बरोबर टाइम मग कॅज्युअली स्पेंड करून देन शी विल फाइंड द मेडिसिन. सो पर्सन. आणि दुसरं म्हणजे आता मला माहित नाही आता इथे किती केसेस त्या प्रेझेंट करतील, डिफरन्शिएटिंग द मेडिसिन. म्हणजे एकदा क्लिपबोर्ड जे काय आपण आता जसं करतो अनालिसिस, इव्हॅल्युएशन, आणि त्याच्यानंतर फायनली जो काही डीडी तो जे एक्सप्लेन करतात ना विथ अंडरस्टँडिंग की कुठल्या रोला किंवा कुठल्या हे जे काय आहे ना त्यांचं बेसिक स्ट्रक्चर और प्लान इतकं क्लिअर आहे ना. And with that knowledge, the way she differentiate the medicines is too good. You can just learn from her. That's it.
Thank you, ma'am. Welcome, Chanda ma'am.
Welcome.
By the way, what's your name? I didn't get it. What's your name?
Dr. Smita Nayak. Smita Nayak.
Okay.
Yes, ma'am.
And you are Shailesh?
Yes, ma'am. Good afternoon, ma'am.
Okay, Shailesh.
We will start the session. We will start the session.
Yeah, sure. So, hello everybody. Thank you for inviting me. Now, Anuprita has praised me so much, so I hope I can do the job properly. Yeah. So, let me start. Can you see my screen? Okay. Is my voice okay?
Yes, ma'am, we can hear you.
Okay, 1 minute. Okay. So, little bit I'll tell you how to approach fever cases. So, first and foremost, of course, accurate case taking is required. Okay, that goes without saying. And observations are very important. Like, is the patient dull, active, and is he looking toxic? Yeah. So, basic observation is very necessary. Then we should go into minute details of the fever. How it started, what is the probable cause, what is the pace, did it come suddenly or built up gradually over a few days, what is the periodicity, whether it is coming every 6 hours, 8 hours, 12 hours, alternate days, whatever. So what is the pattern? And in every case, try to find out the PQRS, which will help you in giving the remedy. Yeah. And also look out for concomitants, right? So just see the pattern of fevers, whether it is first there's a chill stage or thirst stage or heat stage. And like I said, look out for peculiarities. Like if the patient is thirsty during chill stage, it is little different, no? Or if the patient is thirstless during the heat stage, that is also peculiar, no? So that all you look out for. Small things you must look out. So it becomes very helpful. Then you see the symptoms which appear during the 3 stages of fever, that is chill, heat, and sweat. Then you see which system is involved. Is it respiratory? Is it gastrointestinal? It is urinary? Is it neurological field is involved? So just first localize where is the fever coming from. Then it goes without saying that physical examination is a must from head to toe. And in addition to the general and the systemic examination, we must also feel the patient. If the patient is warm or cold to touch, and see the color and coating of the tongue, very important. And of course, look for concomitant symptoms and check out the modalities in the case minutely, very important. Don't miss it. So all this is the theory part. I purposely kept it short because once I discuss the cases, this all will become more clear, right? So let's move on to the first case. So first we'll do simple cases. So this is a case of tonsillitis. So this 7 years boy, he came with cough cold since one day. And I saw his throat. So there was a pus on the right tonsil. There was a septic focus on the right tonsil. And he had mild fever that time because he came on the first day only. So I was taking the history and this mother, she wasn't very expressive. Okay. So I was not getting much information. So she said he just bullies his younger sister and thirst also was not very clear. And the patient has come with his sister also. So mother and sister and brother, the patient, they all have come together and both of them are playing, and creating a ruckus. Okay. So I'm not getting proper clear cut symptoms. So I'm just waiting, something will happen and I'll get a clue. So in the meantime, I noticed this child had an attitude, and wasn't listening to the mother. Mother was saying, this is a doctor's clinic. Why are you making so much noise? But he would just not listen. So then I was just waiting. There's some clue I get. So what he did is, so it was just right tonsil, right tonsil and this bullying and dictatorial and this haughty attitude. So I just gave Lycopodium 200 at that point. I could not think of anything better. Okay. Then after 2 days, this child came back with pus on the left tonsil also. Okay. So it has traveled from the right tonsil to the left tonsil. Okay. And also the mother said he had been coughing whole night and he had got up crying many times. And there's no other PQRS, okay? And he had fever also, whole night he had fever. So like I said, I was observing the patient. So this child and the sister, they were playing in the waiting area. So what he did, he came running inside my cabin and he locked the cabin door. So the sister was outside and she kept on banging the door, okay? So the patient shouted at his sister outside. he told her, if you don't bang the door for the next 15 minutes, I will open the door. Okay. So the poor girl was sitting alone outside and banging the door, and this fellow was not opening the door. Okay. He's telling, if you don't bang for next 15 minutes, I will open the door. And then he smiled at his mother and said, I tricked her because we are going to leave before 15 minutes. Yeah. So, this was enough for me. So I took the rubrics. Inflammation, throat, right side, haughty, dictatorial, then throat, right, then left, because right tonsil is involved, then the left tonsil, then bargaining, like he's bargaining with his sister, if you don't bang the door, then only I'll open the door, and deceitful. So this is the repertory chart. So then I decided to give sulfur, okay, because it's covering all the rubrics. Yeah. So child slept peacefully same night. Remember, the mother said whole night he was coughing before that. So immediately after sulfur, he slept peacefully and was fine the next day. Okay. So I've noticed if the medicine is right, it works very fast. It can work faster than the most broad spectrum antibiotic. Okay. Like I've done general practice for about 13 years. Okay. Initially. So I know antibiotics, they take 2-3 days to start working. It can't work immediately, like how our medicines will work if you hit on the right medicine. Yeah. And like just I remember I had a very bad sore throat. It was all red, inflamed. I couldn't swallow. And next day I had to go for a picnic. So I was thinking of cancelling the picnic. And then initially, like someone just told me take belladonna 1 ml. And I took it, and next day I was absolutely fine. So I know for sure our medicines, if rightly selected, they work faster than the most broad spectrum antibiotics. Okay. So this is the end of case 1. So we come to case 2. So this is a male, 55 years old. He had fever and slight cold and no other symptoms. So day 1, no other symptoms. Usually I would give just placebo. But this guy is from Pune. So how do I tell him take placebo? So I said, okay, take Ferrum for 6x. Like first stage of inflammation, whatever good it does, like you can try. Then on day 3, the fever is still persisting between 101, 102. And he had sour taste in the mouth. He was tired, thirstless. And he said that I was exposed to very cold breeze in Pune. So then I told him to take arsenic album, 200 in water, 3 hourly. Okay. Then on day 4, he had loose motions. And now he said the taste is salty. And he was feeling cold below the knees. So always ask the patient which part of the body you're feeling more cold or more hot. Okay, that's the good, give a good clue to the remedy. Then fever was coming 12 hourly, and arsenic was still covering all the rubrics, but the fever was not going. Okay. And what would happen, this patient, many patients do this, they keep on taking crocin. Okay. So moment the temperature crossed 100, he would take crocin, So then what happens, we don't get accurate, proper symptoms, So I told him just once, don't take crocin. Let's see what happens. Okay. Because I want original, unadulterated symptoms. Okay. Without crocin. Okay. And he's a grown up man. What can happen if he doesn't take crocin? Nothing will happen. I said, you let the temperature rise and then you tell me the symptoms and then I'll give you the medicine. Okay. So then he complied. He didn't take crocin for 12 hours. And then he told me, doctor, this body ache is killing me. I have severe, unbearable backache. But my appetite is back. I'm hungry. And he was very angry with me. Why you're not allowing me to take crocin? My back is breaking with the fever. Okay. Now, any fever, the back is going to pain a little bit, but this person is saying it is breaking with the fever. So you had unbearable backache. Okay. So we have to take that into consideration. So very easy. I told him take Upatorium perfluatium 200, 3-hour leave. Also, like it was day 5 of the fever, no? So I told him, come on, you do some blood test also next morning. But the fever didn't come back. He was totally fine. So then usually I tell my patients, avoid crocin, okay? Because I know when I get original symptoms, I can cure them faster, okay? I tell them this fever is a defense mechanism of the body. Body is increasing temperature to kill the germs. Just wait, no, see what happens. Don't be in a hurry to keep on taking crocin, yeah? So let's see the repertory chart. So, yeah, Prefatorium perfulatum, fever, heat with pain in the back. And also it covers increased hunger during fever. Huh? So that's why I prefer to give Eupatorium perf, okay? Because that is the only remedy which covers this severe unbearable backache. Yeah. So insist, okay, don't take Rosin. You'll recover faster. Okay. Nowadays, a lot of chikungunya coming up now. So this 14-year-old boy, he had high fever, joint pains. So first day I said, chalo, give Epatorium 200 every 4 hours. Huh? So next day fever persisted and there was bitter taste. He was shivering, he was thirstless, and like he was crying with fever. 14-year-old boy crying with fever. And he wanted his mother to sleep next to him. And he told his father also, okay, you leave the office and come home. Okay, I'm getting scared. And the chikungunya test came positive. So, because of this weeping and this thirstless and, wanting mother, father both together. So I gave him Pulsatilla 1 m 4 RD. Okay. Then next day, no fever. Joint pains are much better, but there's no desire to eat. Okay. So this is, I don't like this. The physical generals must be good. Person, if the fever is still coming from like it has come down from 102 to 101, it doesn't matter. But the appetite must come back. And overall, there should be a general feeling of well-being. The stamina should be better. He should be little active than what he was. So I'm not happy with this follow-up, even if the fever is not there. Okay. There should be desire to eat. He should feel little energetic. Then next day he got fiery red eruptions with intense itching, and that itching was better by ice. Okay. So again, so I gave him Epis 30, 3-hourly, and patient was fine after 3 doses. No itching, no redness, no joint pain, eating better, and he resumed table tennis practice for match next week. Okay. So normally you see, after chikungunya, people have a lot of joint pains and all. So this guy didn't get. He recovered very fast. So like in fever cases, no, you must take frequent follow-ups. Like this is what I have learned from Dr. Shankar. Like patient comes to you with acute problem, you do frequent follow-ups. So then they stick with you. They feel, okay, chalo, doctor is taking interest, calling you twice a day, messaging you twice a day. Okay, how are you? How are you? Then one thing is you get new symptoms if they are coming. So then you can change your prescription fast. And person also feels this doctor is caring. Yeah. So they stick to you. They won't jump to allopathy so fast. So let's see the repertory chart. So this itching better by cold and red eruptions and fiery eruptions. It's covered by Apis and sulfur. And this guy was very fidgety and nervous and very restless. That's why I prefer to give Apis over sulfur. Okay. Am I going too fast or is it okay? Shailesh, I'm going too fast or is it okay?
Hello.
हाँ.
The speed is okay, ma'am.
Okay, fine. ठीक है. Then we come to dengue. Dengue is also very common nowadays, no? So this is a case of dengue. I treated over the phone, and this patient is 28 years old. She's a dentist, and she lives in Rajkot with her doctor parents. So the mother is a homeopath, a friend of mine, and father is a surgeon. Okay. So this mother said she had fever since 3 days in the evening, and she was feeling very cold with the fever, and there was thirst before and during fever. And she wanted to eat tasty food. She wanted some bhel puri or something. Tikka, mitta, khatta. So her mother gave her arsenic album 200 BD for 2 days. Okay, before she contacted me, she already started arsenic. And then that NS1 dengue test came positive, and platelets were 1.28 lakhs. Okay, then after the fever, after 2 days, the fever continued and went up to 103. Then she wanted a room door to be closed so as to avoid noise, and she didn't want to talk, and she was getting irritated if someone spoke to her, and she didn't even want to talk to me. Like I told the mother, let's do a video call, let me see her at least. No, so mother said, no, she doesn't want to talk only, let it be. You, I'm giving you the symptoms, you treat now. That way. So she was very feeble, lying with eyes closed, and there was a headache from tying hair, and thirst was 1/4 glass at long intervals, and there's nausea from smell of food. And she was so weak, she could not get up to have water. And her father put her on IV fluids and IV paracetamol. So then I said, give China 200 3 hourly. So then in the evening, the platelets dropped to 30,000. Okay. So we got very worried. So I said, now let's take the history in little more detail. Okay. So the mother said, she's very sleepy but answers properly and goes back to sleep immediately. She's weak and tired, but she's alert. Okay, so they have a duplex, living on first floor, second floor, like a duplex. So mother's working down, like cooking, whatever, and this patient is on the second floor alone. Okay, with the IV going on, but she's alert. Okay, even with 104 fever, she will tell her mother when the IV is about to get over. Okay, so mother was sure, okay, even if she's busy, my daughter is going to tell me when the IV is going to get over. Okay, so this was a very important symptom, no? Like you're fast asleep, but still you're alert. Yeah. So then this is the PQRS in the case. Yeah, always look for the PQRS. So I saw these 2 rubrics: talk indisposed to heat during. She refused to come on video call also with me, and delirium answers correctly when spoken to, but unconsciousness returns at once. Yeah. So other rubrics also I told, like stomach thirst, heat before, stomach thirst, heat during, then indisposed to talk during heat, and headache, binding hair aggravates, nausea from smell of food, weakness during fever, and the last is a PQRS, delirium, answers abruptly, correctly when spoken to, but delusions and unconsciousness return at once. So the last line you see, it is covered by phosphorus, phosphoric acid and sulfur, this symptom. But I chose phosphoric acid because you confirm from the Materia Medica, no? This is Fatak's, I think. So, sleep deep, but when aroused, fully conscious during fevers. Okay. So deep sleep, but when aroused, fully conscious during fevers. Okay. So then I gave phosphoric acid 1 m in plussing method. Plussing method is like 4 pills stat and you dissolve about 10-15 pills in half cup water, and you give 1 teaspoon every 3 hours. And every time you give, you just stir the water 10 times. And normally you would tell the person to do succussion, but many people don't want to do, or they feel, what is this? And this stirring the water 10 times is more convenient, okay, for most of the patients. So I tell them stir it 10 times every time you give. Yeah. So phosphoric acid 1 ml plusing method. So temperature came down very fast. And after the 2 days, the platelets, they came up to 4,500. And then next day, they shot up to 1 lakh. Yeah. So, and the best part was, after 3 days, she resumed work. Okay. So I've seen patients who take allopathic medicine, they take longer to recover, have lot of weakness. Some have bad joint pains also. Whereas patients with homeopathic medication, they recover faster. Okay. So I've seen this in my practice. Like earlier, like 13 years, I mean, when I was doing that allopathic practice, I saw also patients recovering, recovery was much delayed. But with our medicines, they recover much faster. Then this is another dengue case. So this is a 30-year-old male patient. He called me on video chat. He said he has fever since 1 day. And he comes to me off and on, you know. Like there are some people who are not very loyal to you. They go to allopathy, homeopathy, that way. So he's one of them. So first day of fever, I just gave him placebo. Then day 2, he was restless, thirstless, weak. So I gave him arsenic album 200 in water 4 hourly. And the temperature was around 101, 102 that time. So day 4, he got nervous. You know, he went to his GP. So the GP told him to do the test and take Crocin SOS. Yeah. So day 5, there was no fever, but NS1 was positive. WBC was 2,960 and platelets were good, 1.41 lakhs. Yeah. So obviously the GP said, don't worry, the platelets will fall now. It is okay, no medicine, just take rest. Yeah. So this was sensible advice, no? What else they can do? Yeah. So, but this patient got all nervous and panicky. Okay. Said, you please come at home and visit me because my platelets are going to fall. What will happen? This, that. Yeah. So I went to his house. Must be, I think I went to him at 10 o'clock in the night. And then he went on and on, you know, like half an hour I was sitting with him and I heard him out, heard whatever he had to say. But the main thing he said was, doctor, I'm made of glass or what? Why do I keep on falling sick? My body is so weak. Like the slightest change in temperature, I'm fall sick. Why am I so delicate and fragile? Like, doctor, you know what? I take so much care. I don't drink, I don't smoke, I eat healthy, I eat all fruits, vegetables, nuts, and all that. I'm very particular. I exercise daily. Still, my body gives way. Okay. So, this is my PQRS in the case. Yeah. So, delusions made of glass and cautious. He's super cautious, no? He's taking so much precautions. So, maybe Thuja, single dose, okay? Because there was no need of plusing, no? Yeah, because the fever had gone already. Yeah. So just gave him Thuja, single dose. Next day morning, the WBC was 4,030 and platelets didn't fall. Earlier it was 1.41 lakhs. Now it became 1.45 lakhs. Okay. So they didn't fall. And the best part of it, he had 8 parathas for lunch. Okay. Because past 5 days, he had not eaten anything. Huh? And so I'm very happy with this follow-up. He's eating so much, no? His appetite has come back. Yeah. So earlier, the same patient, I would give him Lycopodium silica for whatever complaints he came for. But during this acute phase, I realized that his constitution is Thuja. Okay. So many times, you know, when you treat when you treat a acute properly, you know, and when you symptoms are very patient never told me that he's feeling so delicate and fragile and whatever. So during the acute state, his original symptoms or original state is very much obvious. Huh? And so this acute will become his constitutional. And after that, whenever he falls sick, I would give thuja. And he's doing very well. Yeah. So it's very important to treat the acute properly. बाद में काम आएगा. Okay. So I finished 5 cases. If anyone has any question, like they can ask now, so that later on it will be difficult to come back to these cases. So any questions till now? Any doubts so far?
No, ma'am. As of now, no question.
Okay, okay. Huh? So we go on to this another case of post-dengue pains. So this patient didn't come to me when she had fever. She came to me later. Okay. Maybe after 15 days of the fever had subsided. So she had severe joint pains and her doctor had put her on Visolone, steroid, Febustat because her uric acid was slightly high and indomethacin. But she was not getting much relief. Okay. So I took a full history, whatever. Yeah. And based on that, I gave her Costicone, but there was no change. And then she came back to me and said, Doctor, I have to go to Switzerland next week. My bookings are all there. I can't cancel and I'll incur a lot of loss to do something. So what I did, I went through a whole history again. Okay. And there's one thing which I had ignored earlier. She mentioned that, after this dengue episode, I can't bear the smell of eggs. Okay. Like previously, all her life, she had been cooking with eggs, she had no problem. She's saying, can't understand after the dengue why I can't bear the smell of eggs. Huh? So I had ignored the symptom. I just overlooked it that time. Then I said, let me see what is there. So in that rubric, there's only one medicine, which is colchicum. Okay. And everyone knows, like colchicum works for high uric acid. Yeah. So it's a known remedy for gouty pains and uric acid diathesis, right? So I gave her colchicum 200. She was able to travel because her joint pains just vanished. Okay. And this patient told me your medicine worked wonders. Yeah. So she enjoyed her travel, whatever. Yeah. So just with one peculiar symptom, you can help the patient. Yeah. And later on, I realized that this colchicum was a constitutional remedy as well. Because what happened, this colchicum comes from the Liliaceae family. And she had problems with her family. She felt they are not including her. They are just leaving her out of family matters. They are not telling her what is happening in the family. So that is one of the symptoms of, one of the sensations of Liliaceae family. Yeah. So later on, the same remedy helped her overall in her other problems also. So sometimes this one single rubric can cover the full constitution. Yeah, not always, but sometimes it can cover. Then another case of post-dengue pains. Yeah. So many of our patients now, they don't come to us for fevers. They think like we can't treat fevers. Let us go to the GP. Yeah. So that is their thinking. So we have to correct them, right? So this patient also came to me after the fever had subsided. Yeah. So she had swelling of both the lower limbs after dengue fever went. Okay. They're all swollen and erythematous. And she said the whole body is stiff and frozen. And all the joints were paining very badly. Yeah. And she was very, very drowsy. In spite of sleeping well at night, she was very drowsy. Okay. So husband, like, we took her to the hospital. He was worried whether she's going into coma or what. Yeah. So we took her to the hospital to get her admitted. But because her CBC and her platelets were normal, they sent her back. Yeah. So then they called me at home to visit her because she was in no state to come to the clinic. So I went and saw her, and she was lying down on the bed, fast asleep. And normally she's a very hyper mother. She's running after her kids, making sure they get food properly, whatever, taking a lot of care of kids. And here I saw that her two small kids were like, they were shrieking, they were crying, trying to wake her up, but she was fast asleep. Yeah. So this was the PQRS in the case again. Yeah. So again, I saw the two rubrics: swelling, lower limb dropsicle after scarlet fever. I did not look for scarlet fever, but this is one rubric I found. Yeah. I just wanted to see which remedy covers this dropsy after fever. So I took this rubric, and of course drowsiness. Yeah. So then both these symptoms are covered by Helleborus. Yeah. So I gave 30 BD for 2 days, and then she was normal after 2-3 days. Yeah. Absolutely normal. Okay. So that is Helleborus, and I gave 30 potency because there was no active fever as such, and I felt 30 would do better in pathology. Yeah, she had those swelling of the feet and all. So then we move on. We go to this case of viral fever. A lot of viral fevers are there nowadays. Yeah. So this is a 12-year-old male. He came to me for fever in the evening clinic. So this chap was playing cricket in the rain in the morning, and he came back home with throat pain, cough, and headache. And he got 101 fever and was feeling very weak. And also he was feeling very cold, and he wanted to sleep all the time. So he told me he was feeling very weak, as if he was going to die. First day of fever, he was so weak, as if I'm going to die. Yeah. And he would get nausea after a bout of coughing. So I took the rubrics: aggravated getting wet. I took a broad rubric, because if you take fever from getting wet, there are only 3 remedies. I think there's calcarea, rustox, and pulsatilla, or maybe dalcamar. I don't remember. So I'm not happy with only 3 remedies. So I took a broader rubric: aggravated by getting wet. Then nausea during cough. Then heat, concomitant sleepiness. For this fever cases, no, I prefer Boning-Olson's repertory. Yeah. Then chilliness with fever. Also, he said, no, I'm going to die. First day of fever, no one dies, right? So I was talking about dying. So I gave him arsenic album 200 every 4 hours. Then after I finished examining him, no, I told his father, now take him, go. Okay. But this patient said, I'm very weak. I can't walk. So his father said, you better walk. I can't carry you. So 12-year-old boy, like well built and all, I can't carry you. You better walk. So he forced him up from the examining table. So that's when this patient became stiff and stopped breathing for 20 seconds, So I got scared. I said, Kya, what happened? Yeah. So I just shook him, I shouted and all, and he was okay. So next day the fever continued. It went up to 103. So then his mother said, sometimes he does drama, like what he did in the clinic, pretending to be very weak and as if he's going to faint and all. Yeah. So I added one more rubric to the totality, that is affectation and feigning sick. Affectation is pretending. Yeah. Of course, he was sick, but he was doing more drama. Yeah. As if he's more sick. It was just first day of fever, no one gets so weak. So based on that, I gave him Veratrum album 200. Okay. But the fever continued. So on the 3rd day, I went to see him at home. So I asked him all minute details about the fever. And when I went to his house, he was Aram says lying down on his sofa in the hall. So then after I finished talking to him, I told him, come, let's go to your bedroom and let me examine you. So he refused, saying he was feeling very weak. So I told his servant, उसको पकड़ो और चलो bedroom तक मेरे को examine करना है. हाँ. And again I felt, he is doing extra. He's pretending to be more weak than what he is. Yeah. So I decided to give him Veratrum album 1M. Yeah. But before someone could come to the clinic, to get the medicine, his temperature shot up to 104. Okay. So I told his parents to get his blood test done. And this fellow fainted while giving the urine sample. Okay. So Veratrum album, there's fainting from weakness also, fainting easily also. Yeah. So since the temperature was 104, I told them, okay, give ibugesic. And after the fever came down, he was given Veratrum album 1M every 4 hours. Okay, because I was sure it is Veratrum album. Because he was pretending so much, I said, Veratrum album hi hai. Okay. And sure enough, by evening his reports came. They were all normal. And he took about 3 doses of Veratrum album 1M. After that, he started eating, got active. Okay, so I'm happy with the follow-up. Then he got temperature 99.6 after 18 hours. Okay, so I'm not worried. Yeah, so earlier the fever was spiking every 6 to 8 hours. And then I told him, don't take medicine anymore. And then he was fine and he went to school also after 1 day. Okay, so many people would have changed the remedy because told it did not work. But seeing his, when I saw him, he was acting so much, doing extra drama. That is Veratrum album. Yeah. So this is his repertory chart. Okay, so I took all these rubrics. Aggravated getting wet, drenched, nausea during cough, fever with sleepiness, fever beginning with chill and then heat, and fever concomitants, fear of death. Okay, very important. He had told me on the first day. And mind affectation. Affectation means pretending. And feigning sick. Pretending. Of course, he had high fever, but he was doing extra drama. So I took feigning sick. Okay. Then both these things are covered by pulsatilla and Veratrum. Okay. But I know this family from a long time, and I know this boy. Okay. His father was very simple. They were very rich people. And this boy would tell his father, "Arey, what you're going around in this Innova car? Buy a Mercedes now." So that I remember in the background. And also with this fainting easily and all, I know this is Veratrum and not pulsatilla. Yeah. So I stuck to Veratrum. So we are like family doctors, after some time. So we know the full family. So I stuck to Veratrum album, and sure enough, it was better. Then case 9 is I'm giving you all short cases. And this baby was 8 months old. Okay. And she had cough, cold, and 102 degrees fever. She was very restless, wanted to be carried all the time. And I gave arsenic album 200. Okay. Day 1, mostly I say arsenic hi aata hai. And next day, the baby was very weak and had thick yellow nasal discharge. Thick yellow. She was crying a lot and was thirstless. Okay. So I gave pulsatilla every 3 hours. Right? Then next day fever subsided and the baby was playing and eating well. Okay. But after 2 days, suddenly baby started crying a lot and wouldn't stop. Okay. And this baby is a IVF baby, born after some 15 years of marriage, very precious. Yeah. So mother could not handle, she could not bear to see her baby crying. So she called the father also from the office. Okay, I can't handle her, she's crying too much, you better come. Okay. And those patients, they requested me, on the way to the clinic, our house is on the way, can you just drop in? So I went to see the baby at home. So I saw the father was carrying her around on the house and rocking her, गोद में लेके rocking. And when he was rocking her, the baby would keep quiet. बंद किया तो again the baby would start crying. So on auscultation, the baby's chest was congested. So I gave her Kali Cup. Better by rocking Kali Cup. So I just gave 2 doses. And within half an hour, the baby was playing normally. Next day, she got a few boils on the scalp. Okay, Herring's law, exteriorization, I'm happy. So I told the parents, don't apply anything. Then she was fine. So fevers, no, you must treat properly. Then if you treat the fevers properly, patient will stick to you in the long run. They won't leave you. So now this baby must be 10 years old. Still, she's with me only. Hasn't taken any vaccine, no other treatment so far. So you must treat fevers. It's very easy. Then this is another upper respiratory tract infection. So this 4-year-old male child, he woke up in the morning and he told his mother, I've got fever. So she took his temperature, it was 100.6. She told him to take a rest now. Okay, no school for you, just lie down. And then she got busy making his elder brother ready for school. Okay. So after some time, he's telling his mother, my stomach is paining. I feel like I want to vomit. So mother left the elder child and immediately picked him up, and took him to the loo because bed will get spoiled, if he vomits. So in the loo, he did not vomit, but he started smiling. Okay. So the mother realized he had fooled her. Okay. Later, she brought him to the clinic. And the mother said he's very jealous by nature and he won't let the brother sleep next to the mother. Very jealous. And they can't tell him no for anything or he gets violent. He starts beating them up. And any race, any competition, he has to come first or he'll cry a lot and he'll hit the child who has come first. And he had mild cold and the examination, I didn't get anything. So I took the rubrics. Deceitful. He's fooling his mother, no? Feigning sick. Again, he's not actually wants to vomit, but he's telling his mother that I feels like vomiting. And he's very jealous. And you can't tell him no. So that's why contradiction aliens from aggravate and is violent. Okay. So looking at his overall thing, he's very competitive, wanting to come first, beating people up. I felt this guy needs an animal remedy. And the 2 animals coming up are lachesis and tarantula. So I had to decide between these 2. And फिर क्या है ना, lachesis usually is a snake remedy, वो छुप के वार करेगा. Whereas tarantula is very impulsive. We just start hitting. Okay. And very restless, fidgety. So I decided to give tarantula. Okay. So tarantula is very impulsive, like I told you, and will hit openly. So I gave him tarantula 1 ml single dose. And after 6 hours, mother called saying his temperature has gone to 103. So I told her to repeat the same remedy 4 hourly and he was fine in 2 days. Okay. So you select the right remedy, then don't get worried if the fever is going up. Just give it frequently. Fever has to come down. Okay. Then next case. There's a 6-year-old girl. She came to me for fever going up to 102 since 2 days. And she was very sleepy. She even went to sleep in the clinic. And mother said she's not very thirsty. And she was not feeling cold with the fever. Generally, person feels cold with the fever, no? So this is important. And I said, क्या खाया? तो खाली सीरा खाया and chocolate खाया, nothing else. And she was very dull. Okay. Then this mother said, during that afebrile state, patient was completing a school project. Okay. And because this patient was having fever and feeling weak and all, mother thought, "Chal, let me help her." Okay. So this patient told our mother, this project is meant for children. Are you a child? Why are you doing my work? Okay. So I was very amused by this, but it helped me, right? Saying, are you a child? Why are you doing my work? No, 6-year-old girl telling this to the mother who's trying to help her. Yeah. So I took the rubrics: fever, concomitant sleepiness. She went to sleep in my clinic, right? Then she's thirstless during fever, dullness during heat, desire for sweet. She had only syrup and chocolate, and she's very independent. No, she wanting to do the project on her own. Yeah. So I had to decide between natrium, sulfur, and naxomica, right? So this child is very independent, very outspoken now. Like 6 years old, she's saying, "Are you child? Why are you doing my work?" Huh? So this is precautious now. So sulfur and naxomica both are precautious, but I decided to give sulfur because patient was not feeling cold with the fever. Naxomica, you know, no, very chilly. So I gave sulfur 201 dose. Next day, child was fine. So medicines work very fast. Then this is technically not a case of fever, but I thought I'll tell you. So the clinic where I practice, opposite building, there's one lady. She's around 55, 60. She's a foster mother. So she looks after these orphans till they find a suitable parents for adopting them. So meantime, she looks after them, and she brings all these orphans. She brings them to my clinic for treatment. So this is the 2.5-month-old orphan baby, and the baby was handed over to the foster mother 3 hours back. Okay, with a file. वो file में लिखा था कि she's on some cough syrup, acid syrup, and nebulization with Budecort and Dolan since 3 days. So no history available. What to do? Foster mother knows the baby only since 3 hours, and baby has come with this file, with this nebulization thing. So here you have to observe. What else can you do? Yeah. So I observed that the child was breathing very, very loudly, and like she had this rattling cough, khar 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 khar. You know. Also, this foster mother, she gave me one good observation कि जब से वो बेबी आया है मेरे पास, उसका tongue is outside. Tongue is outside from the time she came. So I only had these symptoms with me. And so I took these 3 rubrics. और क्या करूं? No other history is there. So only observation matters. So here I took respiration loud, cough rattling, and tongue protruded. Okay. Oh, I put it up in the repertory. So I got all these options: lactices, opium, belladonna, sulfur, carboveg, sina, kali carb, lycopodium, silica, stramonium, arsenic, hydrocyanic acid, naxomica, cuprum, mercor, conium, mercury, ऑनियन क्रोकाटा. अभी इसमें से क्या दूं मैं? हाँ, I don't know what to do. Okay, so again observation. So ये बेबी को देख के मेरे को like I was feeling so sad for the baby. Like she's like gasping and coughing and so much discomfort. Okay, I said इतना छोटा बच्चे को इतना तकलीफ हो रहा है. Yeah, so sad. No parents to look after her. Feeling so bad, and but I noticed the baby was quite cheerful and she was laughing also, smiling, without any discomfort on the face. Okay, which was very unusual, no, from the way she was breathing. Any other child would have been crying or something, crying or restless or whatever. This girl was laughing and like cheerful and smiling and all. Okay, so based on that, I gave her opium. Okay, twice for 2 days. Okay, so everybody knows that Dubric. Well says he is when he is very sick. Usme opium is one of the drugs. So I remember that. Okay, he's very happy in spite of being so badly asthmatic. So this baby slept well and she was fine in 2 days. Okay, there was no need of that nebulization, nothing. Okay, she had gone to allopathy, they would have given her antibiotics, anti-allergics, bronchodilators, whatnot. Okay, so she recovered completely with my medicine. Okay, so observation and this quick repertorization, very important. Because from all these remedies which were there, only opium I could think of was so cheerful. And that rubric, well says he is when he is very sick. Like I remember another case from my practice. The old lady, she had multiple corns on her feet. Okay, multiple corns, and they were painful. So that's why she had come to me, and she was very absent-minded. She had worn a kurta and she had worn it ulta, and she was not even aware of it. So I told her, your kurta is ulta. So she went inside the bathroom and she changed and she wore it properly. Okay. Then I was taking her case, whatever, and she said, doctor, once what happened, she stays in a farm. So a jeep went over her legs, and she said nothing happened. There was no pain, and now these silly corns are paining me. Okay. I found it very unusual. So that time I remembered that symptom, that rubric, painlessness of complaints which are supposed to be painful. Okay. So I had given her opium to this lady, 200 single dose. And she came back to me after 1 month. And then I said, let me see your foot. So I was searching, kidhar gaya sab corns, So she told me, you silly girl, what are you poking me for? All the corns have gone. Okay. So just a single dose of opium and all the corns were gone. So there can be two paradoxes. Painlessness of complaints usually painful, and this corns were paining her, but the jeep went over her feet and nothing happened to her. Okay, so that was very strange. That's why I had given her opium. Okay. Then yeah, another case I remember of asthma. So this child was around maybe 6 years old or something, and her mother had brought to me in the morning clinic, and he had a lot of cough and very bad cough and all. So I gave something, I don't remember what I gave. And then evening, the mother called me. Okay, my baby's breathing very heavily. I can hear the wheezing, and I'm going to take her to Breach Candy Hospital for nebulization. Okay. So I told the mother, bring her to the clinic now. Let me see her again. Let me see him again. So mother is saying, no, there's too much traffic. I can't come. As it is, I'll have to do nebulization. Yeah, so I might as well go to beach candy. I said, chalo, like I'm telling the patient, please, at least you come on video call. Let me see the baby. Okay. So then she came on the video call. When I observed, that baby, he was sitting like this. Normally, with asthma, you are bent forward, no? Yeah. So that was peculiar. I said, why is he sitting like this? See, since morning he's sitting like this. Head bent backwards. And then I asked for, सुबह से क्या खाया? सुबह से खाली एप्पल खाया और कुछ नहीं खाया. Yeah. And I said, पानी पिया कि नहीं? See, नहीं, normally he drinks a lot of water. Today is not touched water. Okay. So I got 3 important symptoms. Respiration better by bending head backwards, craving for apple, and thirstless. Okay. 3 important symptoms. So that is antimptart. Yeah. So I knew the the baby will recover. So I told the mother, please send your driver. Baby will get all right. If he doesn't get all right, you always have the option of taking him for nebulization, na? But पहले मेरा दवाई लो. So the mother agreed and वो driver को भेज के I gave the medicine, antimptart 200. Okay. And like within half an hour, the baby went to sleep and he was totally fine. Okay. So now this mother is loyal. Now nothing. Anything happens, she calls me. No allopathy. So treat acute conditions well, and these people will never leave you. Otherwise, you'll keep on going to allopathy for serious complaints, and for mild complaints, they'll come to you, which is very annoying, no? They must come to you for all complaints. Unless, of course, there's some dire emergency, of course, I'll tell my patients go take allopathy. But where I'm confident, I'll tell them, you come, I'll treat you. Yeah. So that was asthma. Then this is another acute diarrhea. So again, that same foster mother got this diarrhea, got this orphan, just 6 days old. He had diarrhea and he was passing 18 to 20 stools per day. Okay, imagine. And not passed urine since long. Obviously, he was very badly dehydrated. Not passing urine is very dangerous, no? Kidneys can get involved. Yeah. So first, like because there were 18-20 motions, she took her to a pediatrician. Pediatrician said, "Isko leke jao hospital mein." Okay. But these orphans, they have to get admitted to a municipal hospital. Okay. So there was no place. So the baby did not get admission. So that foster mother got the baby to me, and I took a brief history. Child had fever, and he would pass motion immediately after formula feeds. Immediately. And the stool would end with a lot of gas, pat, lot of gas. And then the child would be hungry also, again in 1 hour, which was good. Also, he had few boils in the groin area. Okay. So, खाली इतना ही information मिला. Okay. So, बस हो गया. So, diarrhea after eating, then stool sputtering, pat. Then increased hunger and diarrhea, and eruptions, boils, furuncles. So, aloes, simple. So, gave twice for 2 days, baby was fine. No diarrhea, nothing. Kuch nahi diya, IV fluids, kuch nahi diya. Baby recovered fast. Okay. Then now you all will be thinking कि मैं सब simple cases बताती हूँ. I haven't shown you any bad cases. Yeah, so this was one typhoid case. I'll just come in 2 minutes, huh? Just give me 2 minutes. Okay. So this is the case of typhoid. Yeah. So this is a 35-year-old female. She consulted me online for fever for 7 days. So this she's a homeopath, my colleague, and her Vidal was positive. I think nowadays the Vidal is obsolete now. Should not do anyway. And the IgM for typhoid was pending, and there was mild hepatomegaly, and she was on 2 antibiotics, Taxim and AZ, and CRP was 60, and liver enzymes were slightly high, and she had 1 white stool yesterday, and on her own she had taken pulsatilla 1M for 2 days and arsenic album before she came to me, before she consulted me. Okay, so she said started with very high fever, and during fever there's a lot of headache, and fever starts with headache on vertex, and this pain is so severe that she cannot avoid paracetamol tablet. Okay, so she's a homeopath, so she wants to avoid paracetamol as far as possible, but the pain is so intense that she has to take. So morning when she gets up, there's headache with temperature 101. Then entire day she was fine initially, no symptoms, no energy loss. Then there's a lot of sweat, mouth feels dry, drinks a lot of water. And then first 3 days of fever, there's craving for fried food. Okay. And then from the 4th day, fever started coming at 7 p.m. also. And there were a lot of chills before fever came. And chills were especially on the shin and the calves. Okay, the lower leg. And temperature was 101, 102. CRP was 60. She was scared, okay, the infection settled nahi ho raha hai. She was crying a lot. So then she said, on inquiring further, she said before fever started, there was a lot of emotional disturbance, a lot of arguments with boyfriend, and this was happening since 2-3 months. Okay. And during the fever, the boyfriend's mother had called her, and the boyfriend's mother told her, why you're not fixing the marriage date? And patient got very angry. He said, it's our decision, we will take it. And she was also very angry and hurt because the boyfriend did not come to meet her when she had fever. Okay. And there was craving for fruits and juices. And during chills, she's saying, I don't want fan and want AC when I sweat. I don't like to take rest. I keep on doing something. Then, so then again, paracetamol se symptoms थोड़ा change हो जाता है ना. So I said, give me your symptoms before taking paracetamol. So she said there would be headache, constant heaviness in the head, and she would try to avoid paracetamol, but then the headache would become unbearable, and she would not be able to sit, and she would get very irritated with any sound, and the slightest sound would hit my head very hard. Like slightest sound I can't bear. That's what she said. And the pain is throbbing. Have to keep eyes closed and sit. It is better by massage, better by heart pressure, better by pulling hair, aggravated by slightest sound, and better by pressing eyes hard. Then she said the first 2 days I wanted to stay alone. I don't like people serving me. I want to manage on my own. And I don't like if people have to do things for me. Okay, I want to do things on my own. And she wanted to have burger, aloo patties, salad, pav bhaji, whatever. Then she said I felt very unloved, uncared for. I wanted my boyfriend to be there. He doesn't realize what I want. I feel very hurt. I express my anger. And then she said the boyfriend's mother, she gets obsessed with one topic. I got very angry. Why is she pressurizing me for doing something against my wish? I haven't said yes for marriage. There are some things which are holding me back. Give me time to decide. When boyfriend took 1 year to decide, whether shadi karna hai ki nahi karna hai. And then now you give me time now. Why you're pressurizing me to hurry up? I will say yes for marriage when I feel from inside. Okay. So here I'm probing more because this is the exciting factor, no, for the fever. This is the ailments from. All the previous cases I've showed you, I did not focus on mental symptoms. I focused more on physical symptoms, no, first. But here I'm getting a causative factor. Of course, we all know fever is typhoid is from contaminated food and water. But this girl, because of this emotional problem, her immunity is compromised. Her susceptibility has become low. That's why she's got this fever, right? So I'm probing more, about her mental state. With someone, she said, with someone pressurizing me, I feel claustrophobic. My freedom is not there. I don't want to abide by others. I want to stay alone and not be in touch with people who put pressure on me. Then she said, I met boyfriend's mother before I got fever. And she pressurized me so much that I had to sleep for 2-3 hours in her house because she got a massive headache. Okay, so she had gone to meet that boyfriend's mother. They still live separately. I mean, the boyfriend and the mother live separately. So she had gone to meet that boyfriend's mother. And there she kept on badgering her, कि कभी चलो शादी का date पक्का करो करो करो. So much she pressurized her. Okay, she got a massive headache and she had to sleep there for 2-3 hours in that boyfriend's mother's house. So then she told me Pulsatilla usually helps me in acute, and for headache I take belladonna. And this headache is aggravated by missing a meal, lack of sleep, and heat. And headache and mental state is better by eating. Okay. And then she said, I feel thirsty, mouth is dry. I drink 1 big glass of water every 2 hours. And thirst is there all the time before, during, and after fever. Okay. So thirst is there during all the stages of fever. Very important. So then I took all these rubrics. He said, no, below the knees I'm feeling more cold. So chilliness, partial, extreme lower extremities, then head pain. Now headache is very common with fever, right? In any fever there'll be headache, but this girl has severe headache, so you have to take it. Then thirst during fever, and thirst during all the stages of fever. It's very peculiar. Okay, you have to take it. Then desire for fried food, desire for fruits. Then, of course, love, disappointment, unhappy ailments from aggravate. Okay, this is a strong causative factor. Then appetite increase during fever, headache, noise aggravates, headache, pulsating, headache, throbbing, pressure ameliorated heart, and desire to close eyes during headache, and fever, continued, typhoid. Yeah, by the time that S type had come positive. Okay, and then headache from fasting, headache from becoming heated, and headache from loss of sleep, late hours. Okay, now there's so many rubrics now, so I select what rubrics I want. So these are the rubrics which my medicine has to cover. Yeah, so I've taken broad rubrics. Concomitant head pain, it has to cover. Then thirst during fever, desire for fruits because she was eating a lot of fruits, and this headache, like she said, no, it is hitting me. Yeah, the noise is hitting me. And then I got all these remedies: phosphorus, calcarea, netramure, arsenic, lachesis, ignatia, china, carbovesh, hepar. Okay. Now, what did I give importance to? Thirst during all stages of fever. Yeah. And love, disappointment from your love, disappointment is covered by phosphorus, natramure, lachesis, and ignatia. Okay. So, but this patient I'll give natramure. Okay, because there's thirst during all the stages of fever. What she said, I felt unloved, uncared for. इतना बुखार है, मेरे को बॉयफ्रेंड मिलने को नहीं आया. Okay, feel very hurt, and with someone pressurizing me, I feel claustrophobic. My freedom is not there. I don't want to abide by others. I want to stay alone and not be in touch with people who put pressure on me. Okay, so this claustrophobia and all, this is muriaticum, halogen words. Okay, so muriaticum में क्या है? Betrayed, let down, disappointed, bound, tied down, confined. Okay, as per sensation method. Yeah. Then, so I gave a natrum mu 200 in plusing method. Okay, and immediately next day, headache intensity was less by 40%. Okay, and the second day the temperature also dropped to 100. Third day no fever. Okay, she was taking antibiotics also, but I feel that Netromir also worked because her most important symptom, the headache, went away, and temperature also dropped. Okay, so earlier I was under the impression that our medicines don't work if antibiotics are going on. Okay, ऐसा नहीं है. Agar your medicine is right, it will work in spite of whatever medicines the patient is taking. Okay, like we see many people now coming with, they're taking steroids and antibiotics, whatever. Our medicine will work if it is right. Okay. No, I'll just come again in 2 minutes. Sorry. So let us do either we do sore throat or in the case of COVID pneumonia. So which one to do? We have only 15 minutes left now. You can see my case of COVID pneumonia.
Ma'am, we'll go with the COVID.
Acha, can you see it? I have shared it.
No, we can't see.
Okay, 1 minute. There गया. Okay, now you can see.
Yeah, ma'am. Yeah.
Okay. Okay. So this is COVID pneumonia. So this is a female, 56 years old from USA. So she had studied homeopathy with me long back, but after going to USA, she has stopped practicing. So she WhatsApped me on 10th of April 2020 that she has COVID pneumonia and whether I could help her. I said, sure, let's talk. No, she said, I cannot talk. I'm very breathless. So then I said, okay, send me an email. Yeah. So this is email she sent on 10th of April 2020. She said, I started with itchy eyes and a sore throat on March 12th. And I thought it is allergic. Then on 16 March, there was a feeling of lump in my throat which was stuck and couldn't bring it down. Then she took 1 dose of Mucinex. I think it's some expectorant or something. Then the next day she got loose motions just for 1 day, and then she took a probiotic. And then she had a slight cough, no phlegm, and anyway she said the cough was not bad. Then after 4 days she developed low-grade fever with chills, and the fever never went over 101. And she had taken azithromycin because the doctor said we need to rule out bacterial infection. So she took it for 5 days. Okay. Then she said I was not feeling good. So she went for a COVID test on 23rd and it came positive. And along with the COVID test, they do this flu and this streptococcal swab also, which was negative. Then she said fever, there was no fever from 26th March. And from 30th March, she was feeling better overall. So she started doing her routine activities at home. And she was able to manage okay, but also a couple of days she went and walked for a few minutes in the backyard. Then, but since last Sunday, 5th April, so I walked for a few minutes and I got very heavy breathing. And then slowly that shortness of breath started when climbing stairs or when lying down. So she lives in a bungalow type, she has there's first floor, second floor, that way. Then she said sitting at home, sitting at rest was okay. And since yesterday climbing stairs and talking after that, she became nearly out of breath. And even she was out of breath while talking on the phone. Yeah. And then this email is continuous, like she's telling more on the email. See, my current symptoms are constant heaviness in the chest. I feel a tightness. I become breathless when climbing stairs or talking. And when at rest, I still have heaviness in the chest, but not breathless. And she said, night lying down is very uncomfortable. And since yesterday also, there's pain in the right upper back, kind of a stabbing pain, stabbing. And oxygen levels were 97%, pulse is between 70 to 85, and BP was high, in spite of medication. And obviously, there's a lot of anxiety. How will I manage what to do? And she was not able to sleep for more than 3-4 hours. And what would happen? Like every 45 minutes, she would get up from sleep, breathing really fast. Okay. And then she cannot fall back to sleep. Then today there's a persistent pain in the right side of the upper back. And when I was uncomfortable, I was started getting few burps also. And she said maybe the burps are due to anxiety. And she has been doing all those deep breathing, steam, hot water, whatever. And she said, now that I know I've got pneumonia, I'm getting more anxiety. Because I was better, last week I was better, but now it's becoming pneumonia, so I'm more anxious. Thirst and appetite is normal. Maybe your thirst is little more, or I'm constantly having more warm water. And right now there's a tightness in the chest, heaviness, and shortness of breath, along with pain in the back. That is the main symptom, and lack of sleep. I really think I need to rest and sleep better, which would help. and she's not able to focus thoughts on anything and feeling very anxious, worried about family. So this is the X-ray report, which says characterize a mild focused manifestation of COVID-19 pneumonia. Okay, and the right upper lobe is affected. Okay, the right upper lobe. So this much email was not enough for me. So I started asking a few questions on WhatsApp. Then I'm not comfortable lying down. I have to sleep in upright position. And there's pain in the back, lying on right side. Right upper side is affected, no? Then I get up every few minutes, breathing very fast. Unable to focus, anxiety, paying for warm water. So all this I gave arsenic album 200 TDS. But after 2 doses, she got more breathless. So husband got worried. He called for an ambulance. So those paramedics came and they checked her oxygen levels. Because it was 97, they advised her to stay at home because the hospitals in USA were full that time. Okay, at the peak of COVID. So she said my dyspnea has increased, and she said someone is squeezing the middle of my chest, and there's choking and constriction in the chest, and I feel somebody has put a knife in my chest. Okay, the stabbing pain. And there's lump in the throat. I can't swallow. I have the urge to drink warm water so that I can swallow. And I'm belching continuously, and it is affecting my breathing. And I'm sleeping in a chair. I can't sleep on the bed. So got enough information, right? So rubrics: chest inflammation, lungs pneumonia, right. And the X-ray showing upper right is affected, upper right lung. Okay. Then respiration difficult, aggravated by ascending, talking, pain, stabbing, very important. Then chest heaviness, choking, constricting. Respiration difficult, aggravated by lying down with eructations, and respiration difficult, better by sitting, and eructations. I have taken both because she was not sure whether the eructations were helping her or not. Then another important symptom was chest pain, squeezing, desire for warm drinks, throat lump aggravated by swallowing, and most important, sleep, waking, breath wakes to get. Like every sometime, like she'll sleep, again she'll get up with a start because she's breathless. Okay. So I got all these rubrics. Now these medicines, lacusis, sulfur, arsenic, bryonia, calcarea, kalicarb, laxamica, whatever. Okay. So materia medica, final justice will come from materia medica. So I found in lacusis all this. Alinsky notes, all symptoms aggravated after sleep or aggravates him from sleep. Yeah. This is a keynote of lacusis, no? As soon as he falls asleep, the breathing stops. Then Boric, there is sensation of suffocation and strangulation and lying down. Feels he must take a deep breath. Yeah. And Borland's pneumonia, with chest involvement, they always have a horrible feeling of fullness in the chest, just behind the sternum. And with respiratory distress, patient always have a terrible choking sensation. And they also have acute stabbing pains. Okay, very important, stabbing pains. I gave lacusis 200 TDS on 11th April. Then 12th, she told me she was 30 to 40% better. Yeah. And she still had tightness in the chest. We got up in the middle of the night, but was able to fall back asleep soon. Appetite is good. Heaviness in the chest is there. And then I told her, continue lacusis TDS. Okay. So she told me, you're amazing. And it is not me. Our homeopathy is amazing, right? Then, and she said, better, sleep better, heaviness and constriction have reduced, but increases on waking. Then first time she spoke to me on the phone. And she said, heaviness is increased after climbing stairs. Then she asked me, my oxygen levels are okay. What if my heart is affected because of COVID? Okay. So I reassured her, okay, don't worry, lacusis works for heart also. So I told her, continue lacusis BD. And next day she couldn't sleep well, woke up every hour due to fast breathing. So I made from BD, I made it TDS. Then 60 to 70% better, sleeping well, tightness in chest is less. Pain on the right side of the upper back persisting. Because she went up and down the flight of stairs 7-8 times. Okay. In the USA, you don't get help now, no servant, you have to work. So poor thing, she had to work. And then these 2 days, because she was 60-75% better, she did not take lacusis. Yeah. Then again, she got tight in the chest, heavy breathing, because she was talking on the phone. And then she got the news that her friend's husband died of COVID. So obviously she got more anxious. I said, chalo, now take one more dose of laxative. Then after that, all right. Okay, started cooking also. Started doing office work also. Okay. And from the time I gave her laxative, no, she did not take any other medicine. And then on 24th April, she was busy cooking and doing office work and managing well. Okay. So she was totally fine. Okay. So, Dr. Sailesh, will you stop here? Or you want me to do one more case?
We can take question answer, ma'am. That would be much better. What do you
Okay. Okay.
Huh?
Before that, Taskeen, are you there? Taskeen, are you
Yes,
there?
ma'am. Yes.
So just let us show some 2 slides and then we can go on to question answers. Yeah.
Yeah, yeah,
Sure.
yeah.
Sure.
Okay, Taskeen. I have stopped sharing. You share your slides.
Yeah. Is my screen visible?
Yeah.
Yes. Hello, everyone. I am Dr. Taskin from Homeopathy Musing, and I would like to quickly introduce you to one of our courses that's coming up in October. So this course is called the Integration of Classical with Contemporary Homeopathy. This is the version 3. We already had previous 2 courses. So what would this course be about? It is a 15-day practical course where there will be integration of both classical and contemporary homeopathy. Now, you might be aware that there are a lot of concepts that have come up in homeopathy, and there it can be overwhelming for some people at some point of time. So, how to integrate all these concepts, right from the classical, the traditional homeopathic concepts to the new concept? You'll get to learn how to integrate and put them into practical use, and how it will help your prescription, how it will help you understand the patients and your remedies better. So this course is basically with an aim to integrate all the concepts in homeopathy and help you further with your prescription and your remedies. So the highlights for this course will be, it will help you to learn the concepts of kingdom, miasm, sensation, help in in-depth understanding of the personal evolution method. Also, you can master the use of mineral, plant, and animal chart and how to integrate them in your practice. There will be also practical training with several cases from the plant, mineral, animal kingdom, along with nosos and sarcos. Now, who should join this course? So, new and seasoned homeopath who are already practicing classical method, but sometimes they found themselves you are getting stuck in your case, or you want to enhance your practice and learn certain contemporary tools, they can join. Also, those who have some basic knowledge of contemporary concepts and want to learn further about these concepts can also join the course. We have with us the primary speakers will be Dr. Preeti Shah, Dr. Prajakta Vaidya, Dr. Reni Shah, Dr. Chanda Shah, Dr. Jyoti Uripu, Dr. Charu Vahan, and Dr. Kamlesh Kakre. All these speakers have come up to help you by integrating the concepts of classical and contemporary homeopathy and help you put them in practical use. So this is all about the course. It will start from the 15th of October, and we'll have total 15 sessions. The registrations are open. It is very economically priced. In case of any questions, queries, or if you want to register, you can contact homeopathymusings@gmail.com or the number that has been flashed on the screen. You can make note of the number and you can just give a call, or you can put an email on our registered email ID. Yes, ma'am. If you want to further elaborate on this course, I have.
Yeah. Okay. So today I've shown you all simple cases where we did not need to use sensation method, whatever. but it was there in the background in my mind. So we are not going to treat only simple cases, right, in our practice. We must know how to treat blood pressure, diabetes, autoimmune disorders, whatever. Okay, and this can come only when you do, when you increase your scope. Like, you know, you learn all these different methods, like sensation method, personal evolution method. Then only you can go ahead in your practice. Okay, so this is all I have to say. Now we are open to questions.
Yes, ma'am.
Yeah.
So I have two questions.
Right.
First is that when we are sure of the remedy, and how do we come to know that we have to increase the frequency or you have to increase the power? And the second question is, like, in 2-3 cases, we noticed that there were skin eruptions after the fever went away. So usually in chronic cases, it occurs that the sora comes up to the skin. In acute cases also, is it common? And we are supposed to leave the skin eruptions like that without giving any remedy if the remedy is right.
Okay. Okay. So the first part you said when to give the higher potency or when to give more repetition. Okay. So if the fever is not rising so much and the generals are not so bad, you continue with the same 200 potency. But if you feel okay, the fever is rising more and person requires, and you're sure of the remedy, yeah, and so then you increase the potency. If the generals are getting better, then stick to 200. But you feel thoda extra more, or the mental symptoms are more prominent, yeah, then you step on the potency, give 1 m. Okay. And about the second part of the question was, what was the second part?
Skin eruption.
हाँ, skin eruption. So सर जरूरी नहीं है कि chronic cases में ही आएगा skin eruptions. It can come, not in all cases, but in some cases it can come. So it's good, no? And if it's mostly all these skin eruptions which come, they will subside. If they don't subside, then you treat it. But initial, at least for 1 week, don't do anything. Let the skin eruption be. Mostly they'll go away on its own without any other medicine. Otherwise, you'll suppress. Yeah. But of course, it is very distressing. Then you give some remedy. Like for that chikungunya case, the eruptions were the fiery red and a lot of itching was there, a lot of distress was there. Then you have to treat it. Okay. Then you give the acute totality, and that's how I give APIS to that patient. Okay. That way.
Madam, how do you decide when to give crocin, when not to give crocin?
मेरे बस में है तो आई टेल पेशेंट डोंट टेक क्रोसिन एट ऑल. हाँ, पर अगर छोटा बच्चा है तो आई एम वरीड उसको it will go to his head, so I will give crocin, but I will tell the patient, बाबा पहला सब symptoms देख लो क्या होता है, and for babies if it goes above 101, I said okay, give crocin, and more important, do tepid sponging now, say fever will come down faster than crocin. Yeah, so that is what at least my adults, I tell them avoid crocin because now they've realized that you can get all right faster. That way I do with my patients. Or I tell them, chalo raat ko le lo, at least you sleep comfortably. Well, you can't be too rigid, otherwise you might lose a patient. Sorry.
Good afternoon, madam. This is Dr. And I would like to get back to the Heliborus case. I would like to know that the prominent symptom was already available to you and the prescription was made on drowsiness. So why did you adopt 30 potency and just BD repetition? As in other cases, you have gone on higher potencies and frequent repetitions where the symptoms were quite prominent. While in this case, you preferred to go a little slow, 30 potency and BD. So what was the actual thinking behind it? Can you please share?
Yeah, sure. So fever to gaya tha uska. There was no fever.
Yeah.
And that the swelling was there, edematous below the knee joint, swollen. So I felt it thoda pathological hai. So in pathological cases, I like to give 30 potency. And I know this patient, pehle se she is coming to me. Her constitution is not very porous. So then I prefer to give 30 potency, BD for 2 days, and it worked. Agar काम नहीं करता, then I would have stepped up. like another patient I had given Helliborus. It's very interesting. I should tell you. So this one was this patient. She was in coma, and she was in chronic renal failure. Okay, so that pathologist, sorry, the nephrologist, he told the patient's relative, okay, let's stop the ventilator, and अभी कुछ नहीं हो सकता है, because the lady was already 85 years old and she was in deep coma. Okay, so but the patient's son insisted, okay, no, you come and see my mother. Okay, ऐसे मैं क्या करने वाली हूँ, हाँ ऐसे चलो बोल रहे हैं तो you can't refuse. So I went to the ICU and I saw, I pinched the patient and all, there was no response. She was in a deep coma. Okay, so and then I came back. I said, मैं क्या करूँ now? What to do? So then I read in Dr. Sarkar's book. Okay, dropsy. Okay, plus urine scanty because of renal failure, plus slowness, dullness. Okay, so that is covered by Helliborus. Yeah. So this patient also I gave 30 BD, or I think TDS, I don't remember. And I mean, to my surprise, she came out of her coma. Okay, they removed that ventilator, whatever, and she came back home, and she started screaming at the daughter-in-law, "What are you standing? Come make bhajiyas for me." Okay, and she came home and we had those 5-6 bhajiyas and all. So I was really surprised. So like this, like in pathological cases, I prefer to give 30 slow, 30 potency, and it works.
Ma'am, Dr. Meenal here again. How do you decide that this acute could be a constitutional and this will not be a constitutional? Because earlier you made you said a sentence that generally in acutes the actuality of a personality comes out, and the acute can be used as a constitutional henceforth in any acute that is coming up for that patient. So
Okay.
yeah. So how would you differentiate?
Yeah. So it sorry, I meant it depends from case to case, right? So
Okay.
in this COVID pneumonia, which I gave lachesis, her constitution is not lachesis. Yeah.
Oh.
Her constitution is something else. I think it is mag carb or something. Yeah. So it depends from case to case, but many cases like you find okay, you have taken the history again and you know this can be a constitutional. Okay, so it is not a blanket rule for every case. Okay, acute mein kaam aaya to it is a constitution. No, it is not that. Sorry, I didn't mean to say that, but in some cases it can be the constitutional.
Okay, ma'am. Thank you.
Okay.